All right. We've got still a couple people coming in, but we'll go ahead and get started. So good morning, everyone. My name is Amanda Kacherka. I'm the Program Director for the Erie Regional Chamber. And we thank you for joining us today for this incredibly important topic. And I think it's a great opportunity for the Erie County Department of Health just to disseminate some additional updated information. It's been a while since we did our last session, so we were, I think, overdue to do one. So I'm glad that Brianna reached out to me and asked if we could partner with them on this. So our presenter today is Brianna Adams. She is the Director of Environmental Health Services at the Erie County Department of Health. And I think a couple of her colleagues are going to be joining us as well today. So they'll be popping in and out. So without further ado, Brianna, I know you have a lot of information to cover, so I'm going to turn it over to you.
All right, wonderful. Thank you, Amanda. Good morning, everybody. So as Amanda said, my name is Brianna Adams. I'm the Director of Environmental Health for Erie County Department of Health. Joining me today is David George. He is the Supervisor of Environmental Health at Erie County and also has been working as the Director of the environmental branch in our COVID-19 response. As you all know, we've been working really diligently on the COVID-19 response, and I'm going to share some of that, but also sharing how to navigate it as an employer yourself. We know that our cases are rising, and in multiple instances, it seems that COVID is coming closer to us. You know, I had someone sharing the other day that when it all started, you know, in March, April, May, you know, maybe even through the summer, they didn't know anyone that had COVID, and now they know several people that have contracted it or had to quarantine or anything else. So I have a presentation that I'm going to share with you now, and I have sent it to Amanda to share after the presentation, and I know that it is also being recorded, today's information. So it will be available after we're done talking this morning. If you have any questions, feel free to share them in the chat box and we can get to those either throughout the presentation or at the end. Melissa Lyon, the Director of the Health Department and our Incident Commander for COVID-19 response, will also be joining at some point during the call and will likely share a few words with you. So first of all, I just wanted to share that environmental health services, what we do in a normal year is that we're responsible for all of the compliance and regulatory work through the department. So we take care of licensing and inspections at food facilities, restaurants, grocery stores. We also inspect schools, pools, campgrounds, manufactured home parks, and body art facilities. We have staff that permit on-lot septic systems for private residences as well as small flow treatment facilities. We work with DEP, the Department of Environmental Protection, very closely on inspections and compliance at wastewater treatment plants and some drinking water supplies. We also conduct beach sampling for our beaches on Presque Isle, as well as Freeport Beach. We do mosquito surveillance and testing throughout the county and tick surveillance as well. So we're kind of all over the place. We're really out in the community all the time, and that is our normal operation, what it looked like, you know, last year. Things that have changed with the pandemic response is that all of the health department now is working as in an incident command system. And so what this is just a structure to allow us to maybe change who everybody is reporting to, how things are being reported out. And we've been working that way since March. All of the staff at some point have been involved with pandemic response, and the majority of our staff still are involved in the response. We are hiring and training dedicated staff for call center lines, complaint and call center. So in March and April, it was the environmental staff that were taking care of all of those complaints. At this point, we have dedicated staff to really try to help the people that are calling in, whether it's with a complaint or with a concern with a business or questions about quarantine and isolation, and I would be lost without their help for this presentation today. So I really want to thank the people that are jumping on board with the health department during the pandemic. We're hiring a lot of people, almost doubling our workforce so that we can continue the response and see it through for the next period of time. Disease investigation and contact tracing is something that is happening through our department and that I'm sure that you all have heard a lot about. We've been reaching out to people who are identified as having COVID-19 and then reaching out to their close contacts. Because of the number of cases that we've been seeing since late October, that process has changed. All of our staff now is just focusing on disease investigation or like mini investigations, and they're starting with the highest priority cases, which are those involving workers at a long-term care facility. So other people that have tested positive or identified as having COVID-19 may receive a call from our contact tracer who would just get the information of some of their contacts, and then we are passing that along to the State Department of Health for their assistance. I wanted to mention that because there is the chance that if you're identified as a contact, you would be receiving a call from someone outside of the 814 area code or outside of Erie County Department of Health that would be a Pennsylvania Department of Health worker. I wanted to just make sure that we're on the same page and share a couple of definitions first before we get into what some of the actual quarantine and isolation details would look like. And I guess I just want to make sure that you all are seeing my screen and everything too. The definitions that I wanted to share are a confirmed case. So that's a person that's tested positive, no doubt about it. They've tested positive and have coronavirus disease. A probable case is someone who is in close contact to a confirmed case and then becomes symptomatic. So if you know that you've been exposed and then you become symptomatic, it is probable, you are considered a probable case of someone that has coronavirus disease. Erie County Department of Health, school pandemic coordinators, and primary care physicians are the ones that are making that designation to include that person then in the case count. Of course, we would always recommend getting tested if you do have symptoms. And I have information later in the presentation about where you can get tested or where you can find those testing sites. A close contact is someone that is within 6 feet of an infected person or a person during their infectious period for 15 or more consecutive minutes. So really within that 6 feet, I know that we've heard so much about that since March, but it's within 6 feet for 15 or more consecutive minutes, and you'll see that play through in some of the different scenarios that we're sharing. The other definitions to talk about are isolation and quarantine. And so isolation is totally separating an individual that's been diagnosed with COVID-19 from people who do not have it, and that lasts for 10 days. So that could be within a household, if they have a separate restroom that they're able to use, a separate bedroom, all of that, maybe meals are getting placed outside their door, just totally 100% isolating that one person from other people who do not have COVID-19 for 10 days. Then there's also the quarantine period. So that would be restricting people who were exposed to COVID-19 to see if they become sick. And they also, and a quarantine period would also happen between the time that they would get tested and are waiting for test results. And then I had to put this big, nice disclaimer on the bottom here, but I do need to share that the Centers for Disease Control, the CDC, yesterday announced that quarantine and isolation times might be reduced. There's some different stipulations that they're looking at putting in place for those that involve testing. There's a 7-day time frame, a 10-day time frame, depending on what's happening or what the situation is. So the Pennsylvania Department of Health is reviewing all of that information right now and has not adopted that into our COVID-19 response guidelines. So what we're talking about today is still within the guidelines from Pennsylvania Department of Health. If that does change at all, I would be happy to share that information with Amanda, and we can get it out to all of the attendees on this call. But so I know that you maybe saw those headlines yesterday. I didn't want to not mention them, but what we're talking about right now is still a 10-day isolation period and a 14-day quarantine period. The symptoms that we've all become very familiar with, are cough, shortness of breath, difficulty breathing, fever or chills, muscle body aches, vomiting and diarrhea, and loss of taste and smell. I wanted to share a few of these because things like the loss of taste and smell can last for a long time after someone is through their infectious period. Some of those other things we know are symptoms of other illnesses that people generally get this time of year as well. So a full list from the CDC includes, a cough, shortness of breath, fatigue, a sore throat, congestion, runny nose, nausea, vomiting, diarrhea, and there's a whole list. And so those symptoms could appear within 2 to 14 days after the exposure of the virus. So those are things that you might want to be screening, that you do want to be screening your employees for, making sure that they don't have that kind of illness. And I know that the question comes this time of year between what's the difference between COVID-19, the flu, and the cold. And so I found this chart very helpful and wanted to share it with you all today. It goes through some of the common symptoms or more rare or moderate symptoms of the cold, the flu, and COVID-19. Sorry. So now I wanted to talk about quarantine and isolation, and I thought the easiest way to do that was to go through some of the calls and questions that we've had and kind of lay them out on a calendar. So in the next several slides, I have different calendars for different experiences or different scenarios that yourself or one of your employees might face. So what I did was, what I did was I made a key, and so there's a red circle for when the symptoms begin, a positive or negative test, different colors for isolation and quarantine periods, and a smiley face for when they can come back to work, because I know that that is what one of our biggest questions, is when can this person come back to work? What does that look like? And what do we have to do? So if someone is not has not been exposed but decides to get a test, maybe they just have symptoms as shown on these calendars, or if they had traveled, anything like that, they do have to wait while they are at home waiting for their test. I'm sorry, my computer is being super responsive. So in that first line, the first dates on the calendar, you can see that someone was symptomatic on Monday. They went and they got tested. They received a negative result on Thursday, so they can return to work because that person had not been exposed to COVID-19. They maybe just were feeling kind of under the weather, decided it was in their safest bet to get tested, and came back negative. Now, the person in that second line there, they had some symptoms on Wednesday, got tested, and got their results back as positive on Friday. Now, a person who tests positive for COVID-19 disease has to isolate for 10 days. So those 10 days begin from the first date of their symptoms. So they're starting on a Wednesday, that is considered day 0. And then you can count the days 1, 2, 3, 4, all the way through 10. They can return to work then on day 11. So that's where that smiley face is there. If one of your employees tests positive, again, there is a 10-day isolation period that starts on the day of their symptoms. So hopefully you're doing that screening at the door, you're checking, having them report if they are feeling ill to you in any way, and they don't come to work on that day, on that Wednesday, they're feeling symptomatic, have a sore throat, have some shortness of breath, any of those symptoms listed, they go and get tested, they come up as positive, you can know and you can plan that they will be out of work for the next 10 days. They can return to work on day 11 if their symptoms have significantly improved. And that's where that, like the loss of taste and smell may not be back on day 11. It's not like, after 10 days, it's totally gone. But that isolation period is considered their infectious period. And so they can return as long as those symptoms have significantly improved and they're not using any fever reducing medicine. Our next scenario is if an employee was exposed to COVID-19. So I put this one on a Sunday. Maybe they were watching football with one of their friends. Maybe it's on Sunday, maybe it's on Tuesday, who knows. But so say this Sunday they were watching football with some of their friends, and then they come back to work, they're working for you, Monday, Tuesday, and on Wednesday they find out that their friend had is positive. They had come down with coronavirus. So what they would do then is quarantine for 14 days, which starts on the day of after contact with that positive person. So they, again, that day of contact is considered day 0. You go a full 14 days after that, and they can return to work on day 15 if they are not symptomatic, if they have not developed symptoms during that time. You don't have to do contact tracing or anything for this type of employee. So if someone was just exposed, the risk of like a contact is very, very low. And so so this is all that you have to do with this person. They go home, they quarantine, they stay there for 14 days and hopefully do not develop any type of symptoms. If someone in their household has COVID-19 and if they can isolate, then it is the same exact scenario. So say that someone in their household was tested and has contracted COVID-19 disease, then they say the last day of contact was on Sunday, that person goes, stays in their own bedroom, has their own bathroom to use, has their own area that they can stay in their own isolation, and the employee will not see them then for the next 14 days. The employee is still quarantining, but that positive person is isolating, and if no symptoms happen, then they again can come back to work on that day 15. But sometimes we've heard a lot about a 10-day isolation or a 14-day quarantine period, but sometimes those timelines can be extended, and that's some of the scenarios that we wanted to share with you too, so that you are understanding, if your employee is saying, hey, I know that I need to be out for 18 days or 20 days, those are cases that can happen and do happen. So again, this quarantine period would, for someone who has been exposed, starts on their last day of exposure. So in this case, if someone in their household, their last day of exposure, say, was Tuesday, and they started their 14 days, but then on Saturday, something happened that made them become exposed again, as a close contact, as, exposed to that person for 15 minutes. And so say it's something like that, they had to take them to the doctor, or, maybe their symptoms have become incredibly severe and the second person needs to drive them to the hospital, their quarantine period would start again after that additional contact. So in this case, you can see where this person's quarantine period then has extended by 4 days because of that second contact with the positive person. In an employee household where there's an unavoidable contact, so say that there's someone like a child who tests positive and there's no way for them to become isolated on their own, and your employee maybe is their parent or something like that, then those isolations and quarantine periods can last at a minimum, most of the time, 24 days. So you can see that on Saturday, again, say this is a child, maybe they test positive. Obviously, the parent is with them. So that child's isolation time then works for 10 days. The parent then, or any close contacts then, are quarantining for 14 days after that isolation period. The isolation period is considered when that person can be infectious. So then you still have to wait for 14 days to make sure that you don't develop symptoms after that infectious period. If there's additional people in the household that would then get sick or symptomatic during this time, that period could be even extended longer based on different isolation times, different dates of different isolation starting and adding that 14 days of additional quarantine afterwards. So someone isn't necessarily pulling the wool over your eyes if they're saying, hey, I need to be out for 24 days, I need to be out for longer than that. And there are some resources that we'll share to try to help avoid that, avoid these situations from happening, but they could be happening. And so we wanted to make sure that everyone knows that and is understanding of that. If someone is exposed, so say that they are exposed on Tuesday and then they go and get tested on Sunday and it turns out to be negative, they still have to continue that quarantine for 14 days and return to work on the 15th day. So a negative test after an exposure is not like a go back to work type of card or scenario. That is just something, maybe for their reassurance, maybe they just needed to know or started to feel a little bit funny, but they got a negative test. They still need to stay out of work for that full 15 days. Stay quarantined. I know that those calendars are a lot, and we're happy to answer questions afterwards. If you have a symptomatic employee, I did include some resources here to find testing sites. We currently have three totally free testing sites within the city of Erie every Tuesday, Wednesday, and Thursday. So they're at the Booker T. Washington Center on Tuesdays. They're at the Quality of Life Learning Center on Wednesday and the MLK Center on Thursday. Those sites are totally free testing, no symptoms needed. They're registered on site and testing is being done right there. I've also included the links, and you can get them either through this presentation or just by looking into Google for Pennsylvania COVID-19 testing sites. They've put together, the first link here is a little bit about how the testing works, who should be getting tested, what the symptoms are. And the second link is actually a map that pinpoints all the places that have testing, such as CVS, Walmart, and which locations of those retailers that is. If you do have a positive case, so in your workplace, if someone comes in and says, hey, I found out over the weekend that I was positive, you do have to conduct cleaning of areas where that employee was present. So hopefully you can close that area for 24 hours if possible. So if they have, their own office or cubicle, or if they've only worked in the dish room or only on one certain machine, then conduct deep cleaning of those areas. You want to make sure to focus on some of the high touch areas like doorknobs, things that, again, they're handling that might be handled by other people. Maybe it's a shared copier, maybe it's the handle to the refrigerator in the break room, anything like that would be like a shared touch area you want to make sure to focus on. You want to utilize a disinfectant. And so there's, all kinds of different cleaning products out there. I know that some have been hard to get, but there is a list of disinfectants that are approved for use against coronavirus, and that link I've shared here too. They're called List N disinfectants that work against coronavirus. You will also want to conduct contact tracing within your workplace. as I shared, Erie County Department of Health had originally been able to contact every contact within 24 hours or within 48 hours. We had been making those calls. We had been reaching out saying, you were in contact with a positive person. Now you need to quarantine. And we do not have the capacity to do that anymore. You, as a business owner or manager or anything like that, as soon as you are notified that you have a positive case, you're going to want to begin contact tracing. This could be the difference between running your business, short of 2 people or running your business short of 12 people if the disease spreads within those people or within your workforce. So when you're looking at contact tracing, you want to identify those people that have been in contact with the positive employee within 48 hours before symptoms or before the positive test date if they didn't have symptoms. So if I come in, Monday, Tuesday, and I'm not feeling very well, I get tested on Wednesday, and that test comes back as positive, you're still going to need to go back even, over the weekend to see who I was working with, who I was in contact with, because I had come in symptomatic on Monday. So that always starts 48 hours before symptoms or before the positive test date. An example of someone who might have a positive test date without symptoms is someone that got tested after they had traveled out of state or anywhere, maybe just had close contact with family and decided to get tested. Then they could just come up as positive and you'd want to go back for 48 hours before that. You really have to think about some of the areas that they're sharing, workspaces, break rooms, if they carpool to meetings, if that maybe they go out to happy hour every Tuesday or something like that. If you know about those things that the employees are doing where they might have had close contact with another, it's really just trying to find out that information so that then those close contacts can be quarantined for the appropriate 14 days. I know that it probably feels a little bit like prying or asking some additional questions that we haven't always asked before, right? When someone calls off sick or when someone does say that they have a positive test, but really building this type of trust relationship between if an employee is saying that they're in quarantine and that they've been exposed and giving them, knowing that they're going to have to be out, that's you trusting the employee that they're doing the right thing. And then at the same time, them trusting that turning this information over to you is just helping to contain the disease. That is the whole point of this contact tracing. So again, I did add to the slide too that we are really extended far beyond our capacity, starting with those cases involving long-term care facilities. Then after that, we're looking at cases of 65-year-olds plus, then children. And so we are reaching out to as many people as we can to try to gather their contacts and then turning those contacts over to the Pennsylvania Department of Health. Any person that tests positive is still getting a letter via mail. Any person that is considered a contact might receive a letter via email, but that is not happening in 100% of the cases. We are trying our absolute hardest to provide those letters that, say when they were exposed, what dates they have to quarantine for or anything, and additional information about testing and symptoms should they need it. But we know that we're not hitting 100% of those people. If you have an employee who's been exposed to COVID-19, just really the key is just being aware of those quarantine timeframes and exposures. So if they say, hell, I was exposed, I need to be out for the next, I was exposed over the weekend, I need to be out for the next 12 days, then that that's accurate. But also if they say, my kid was exposed or a family member was exposed and now I need to be out for the next 24 days, again, you can know that they're not necessarily pulling they're not pulling the wool over your eyes. They're not trying to fool you or anything like that. There are scenarios where that is happening. I know that that's a very extended amount of time. And when I was first hearing about some of these different timelines too, I was shocked, and it would be a lot to have employees out for that long. But it is happening. And again, so we just wanted to make sure that employers are aware of those lengths of time that can happen between isolation and quarantine. Again, just that note that we don't have the capacity to be providing return to work dates for every single contact at this point. We are trying to work for a system of that, maybe where people are requesting letters and we're getting those out as soon as possible. But we are more focused right now on getting out the actual letters to the index cases, the people that are positive, and to their contacts at this time. You'll also want to notify probably other employees within your business if you do have a positive case. So again, if you have someone who was exposed, there's not really the risk of a contact is very, very low. But if you do have a positive case that shows up within your building or within your workspace, that does create a lot of fear and anxiety and just kind of turns that rumor mill within your facility. So what we have been recommending to places to do, and you do have to be careful of the employee's privacy, but let people that are impacted know that there was a positive case. You don't have to say, where, you don't have to say in office number 3 in the basement of the health department, this is where the case was. You can say, there was one within the building, there was one within, this division or this floor or anything like that. Let them know what steps you've taken to provide that deep cleaning or close that office space, or how you're making sure that nothing is nothing would be holding like particles from that employee. But then also conduct that contact tracing and let the employees know that, if you were in contact with this person, we've already reached out to you, you're already at home, you're already quarantining. If we didn't reach out to you, then the employee didn't say that you were a close contact of them. And this should help to ease some tensions. But again, it's a big part of that like trusting relationship that your employees have to be able to trust that if a positive case within your business identifies them as a close contact, you're going to let them know and send them home to quarantine so that they can know and help to keep their friends and family safe as well. There is some difference for workers in life-sustaining business. And if you are in one of these businesses where there's critical infrastructure and someone was exposed but isn't experiencing symptoms, in some cases, those people can come back as a last resort in limited circumstances in full out personal protective equipment, including like a mask, a shield, gloves, a gown or a suit. And so that can happen in places that are absolutely critical to infrastructure, places like hospitals, places like keeping water plants running, things that we need really to live. That can happen, but the majority of places are not considered life-sustaining at this point. If it is like a member of management staff and it's going to be harder to run your business, that doesn't necessarily mean that they were life-sustaining or that they're critical. Like someone else can be trained to take on some of those roles while they're out. I know that puts additional strain on everybody and it's uncomfortable, but the key is really keeping these people in isolation or in quarantine for those amounts of time. But then one of the questions that we always get to is, how can you keep your business open? How can I keep my business open if 3 or 4 of my staff were out watching football together and now now they're all out? How do I how do I keep my staff or my team going when it's already limited to begin with, or I can't find people to work? And these are a few of the things that we wanted to share. So teleworking in any place that can do it is mandatory unless impossible. And I know that that is not black and white, but that was updated in the mitigation order from Governor Wolf and Secretary Rachel Levine on November 23rd. So if it is possible to telework, even part of the time, we've seen places that, you know, maybe they go a week of teleworking and then come in for a day or two. As much teleworking as can happen needs to happen. That includes like meetings within your business, trying to minimize or eliminate those in-person meetings, making sure that you have a large enough meeting space if you do need to have in-person meetings. Anytime I know that I'm walking into a room with other people, that is my question, and what needs to be on the forefront, I think, of everybody's mind when you're planning these things, right, is, okay, if any person in this room, including myself, would become positive or symptomatic within the next 2 days, who else in the room is being knocked out because of that? And by knocked out, I mean going into quarantine and not physically able to be there at that point, and what kind of strain would that put on? Also staggering shifts. So we're seeing this, we work a lot with restaurants, right? And there is not a lot of room to space out in the back of a kitchen or as people are doing dishes or anything like that. So having like an A team and a B team is something that I think has been recommended from the start. So making sure that people, you know, maybe have limited contact with each other, or that you always have a backup team if the A team would have a positive person, which would take out a few of those staff members and put them onto quarantine. Making sure that you're enforcing masking and providing masks if you are still operating in person. So the employers are responsible to provide masks and to provide guidance on what type of mask you're going to allow within your business. Making sure that people are wearing them properly above their nose and above their and over their mouth. The below the nose masking is always something kind of odd to me, because the COVID tests are being done in your nose, right? So that nose has to stay covered. But really enforcing it, and again, like I said, providing those. There is, you know, for different nonprofits or organizations that are requesting them, there is a really neat group of people within our community that are making masks, and they're called Mask Erie, and they're just totally volunteers. They're getting some donated fabric and different things, and they've made like thousands and thousands of masks for people within our community. There has also been grant funding available for PPE within your workplace, either through Erie County Cares or through Erie County Gaming Revenue Authority. So making sure that, you know, you are enforcing masking when people are having contact with anybody else. You could also try to do personalized or individualized job stations. So again, using a kitchen as an example, maybe you have someone that just stays in the sandwich zone, right? Or just in the dish area, or just in the just behind the bar, and that they're not really intermingling as much as they used to in the past. Again, consider business messaging or communications platforms to try to eliminate or minimize those in-person meetings. And then the last thing that I put on there is really just setting the example, right? So if you're on this call, you are likely leadership in your business or your organization, and people are, we know that we've been hearing about pandemic fatigue. People are tired of it. People are, you know, just kind of getting over it, but that's not helping our numbers at all. And that's not helping your business to get any further ahead. But really by setting that example, making sure, you know, that people are seeing you wearing your mask, that you're sending out maybe the Zoom invites for meetings, or setting up a calendar that people can check in virtually. Those are really important things for you to be doing as leadership within your business or your organization. There is, I did see a question come up in the chat, and Amanda did share this information as well, but for employers to provide sick time or what needs to be provided for people who are out because of quarantine or isolation times, there is the Families First Coronavirus Response Act, and Julia Herzing from Knox Law is going to be doing a presentation on that on December 15th in cooperation with the Erie Regional Chamber. So Amanda has information about that, and the link for registration is available as well. I am not a lawyer and I am not a human resources professional, so I don't know a whole lot about that act other than that it exists, and it was made to allow for people to be able to take time off if they needed to quarantine or isolate or take care of a family member who is quarantining or isolating. And then I just wanted to thank you all. I've included contact information for myself and David. And David, if there's anything that you would like to add at this point, or Melissa, if you have joined us and want to add anything before we get into a couple of questions, then you are more than welcome to.
This is Melissa, and I'm sorry that I joined late. I'm juggling lots of morning meetings, but I'm very happy to be with you all, and I know that you've been in really great hands with the information that Brianna has shared with you. I do understand this is a very difficult time, and early in the pandemic, we were so pleased with the cooperation and how we could partner and help work through a lot of the decision making and helping with isolation and quarantine of employees. And we were really able to be hand in hand for such a long period of that for so many months, because the numbers were staying low, or what I would say manageable. Unfortunately, where we are now, the numbers are no longer manageable from a public health perspective in the amount of support that we were able to give to school districts and businesses, health systems, long-term care facilities, congregate living facilities. And so unfortunately, I know there is a lot of expectations that we were able to provide in the past, but right at this current place, we won't be able to. We're going to do our very best. And if that means what I was thinking, if that means additional meetings around topics that are of most concern to the business community, we can drill down and we can help do some of that. So I'll just stay on for some questions. And I was also going to say, if there's a point that our capacity improves, we will absolutely go back to providing the same support that we were able to in the beginning, and really we want to be able to do that. So if our numbers become more manageable or our capacity improves, we'll move back into that position. So thank you for your patience and bearing with us as well. And with that, I'll just stay on for questions, Brianna.
Thank you.
All right, so we have the only other question that's come in so far is asking about if there's a brand of no contact thermometer that you'd recommend.
We don't have a certain brand or anything in mind. I think that a good part of the temperature screenings that a lot of places are doing right now is, yes, to check to make sure that no one has a fever as they're coming in, but also I know that here it does provide as a stop to just check in with symptoms overall, right? So as you're getting your temperature screened, hopefully you are thinking, you know, oh, do I have a sore throat this morning? Oh, do I have a cough, or have I had any of these other symptoms? I know we have, we just have like a stand that you stand in front of, and it kind of looks like a little tablet infrared thermometer that you put your face near, and then we have signage, you know, all around there. Do you have other symptoms? And we've heard that complaint of like the no contact thermometers, you know, that someone knows that every day when they walk in, they're going to be the same temperature. But then again, that allows them at least to be in check with that enough that if they see it be higher, you know, maybe that means that they aren't feeling well, or maybe it is on the rise. I know that sometimes they seem to read a little bit low. And so at that point, if you know that your thermometer always reads low and you are seeing that 100-degree temperature, then I would absolutely, send that person home to take their temperature again, or send them home for the day and have them continue monitoring themselves. But we don't have like a specific brand of thermometer to recommend.
Okay, next question is, when an employer is doing contact tracing, are they supposed to contact those people? Do they send a list to the health department? What's the protocol there?
It will absolutely be quicker if you're contacting those people. You can keep a list on hand for the health department, and that would be helpful, or encourage that positive employee to have that list available for when they are contacted by the health department. But you would have a better handle on it by contacting those close contact employees, letting them know, there was a positive case within our organization. You were identified as a close contact to this person. And then, it is required that they quarantine for 14 days after that.
Okay, another question was, if I have employees working with heavy machinery and they're able to be more than 6 feet apart, do they have to wear a mask while they're working on that machine?
The only option to not wear a mask is if they could harm themselves or others. So yes, if they cannot see what they're doing below their mask, whether they're steering or something like that, if it's impeding their view, then the mask would not be required. However, they do make those clear face shields that still allow for some level of protection, not quite as well as the mask. If they have, maybe the issue might be the type of mask that they're wearing too, right? So if it is something that keeps riding up on their face, I know I was wearing cloth masks for a while, and sometimes they would come up closer to my eyes and impede my view a little bit, but now I've switched to a different type of mask that fits better on my nose and, doesn't impede my view. So I would, masks are absolutely one of the best lines of defense that we have. So I would encourage them as much as they can to wear them and just make sure that they're properly fitted. But if it would cause harm to them, then they do not need to have a mask on while they're doing that task. Now, as soon as they come off that machine, then the mask would go back on, but they could consider, maybe a face shield for the time that they're operating that heavy machinery.
And I will also note, I dropped the link just a bit ago for the Erie Regional Chamber's COVID-19 resource page. We update that regularly with information that's specific to businesses. On that page, there is a list kind of toward the top of it. It's in the second section of PPE providers. So if you're having trouble finding masks, face shields, any of that, there are links to both local and statewide providers where you can find those materials for your employees. Any other questions? All right. Well, Melissa, I don't know if you have any final comments you'd like to make before we close.
Maybe it's a question to you first, Amanda. I know that there had been some conversation that filtered up to me around letters releasing quarantine or isolation. Was that addressed prior to me joining, or do you want me to give just our position on that at this point?
Brianna did touch on it, but I don't think having a rehash of that would be a bad thing.
Okay. And I think I alluded to this in my comments when I came on, not being able to provide that same level of support just based on hundreds of cases per day. So at this point, if there were, so it's never been a requirement from a public health perspective that an employee or an employer needs to have that release. We were we got ourselves into a position where we were doing it as a courtesy because it seemed to make good sense at the time and was at that point fairly easy for us to know who was coming off of isolation and who was coming off of quarantine because we had capacity. And so while that was a really fail-proof way of determining that the employee was capable of returning back to work and not being infectious, we've never required it, and we're not able to provide that. We know that that is something that the employers would really like to have, and I understand how much easier that would make it for the employer to have that. So we are internally processing ways that we might be able to do something that would be beneficial or helpful for the employer to determine that, or provide something that might be more generic but still fill the need. So I just wanted everyone to know we haven't ignored this and just moved on and said we can't. We know how important that was for the employers, and so we are exploring and we're working with some of our colleagues across the state to see what they're doing. If you can imagine, most of it would be a type of electronic method of doing that. So just stay tuned, and again, thanks, and be patient with us.
All right, wonderful. Well, thank you to our presenters today, Brianna for doing the bulk of the presentation, Melissa and David for joining us and being able to answer those questions. I will note that, as Brianna mentioned at the beginning of today's session, I did record the webinar today, so I'll be sending a follow-up email sometime this afternoon with the replay link. And if there's anyone within your organization or maybe a fellow business owner who you think would benefit from this information, please feel free to share the link. We want to disseminate this information as much as possible. And again, just a note, if you're looking for resources, have questions about COVID and its impact on your business, I would definitely recommend you check out that COVID-19 resource page on the Erie Chamber's website. I know the county also has a business resource page on their website. Lots of great information there, frequently asked questions, information about the Families First Coronavirus Response Act, which is the subject of our session with Julia Herzing of Knox Law coming up in a couple of weeks. I will make sure to include the registration link for that session in the follow-up email as well. So thank you again, Brianna, Melissa, David, to the entire Erie County Department of Health for the tireless work that you've been doing to keep us all safe and healthy. We really appreciate it. And for your partnership on this session. And thank you to all of our participants today for joining us. Please stay safe, stay healthy. And if you have any questions, feel free to reach out. Thanks so much.
Thank you.